Jennifer, please begin.
Hello and welcome. This is Jennifer Laszlo Mizrahi, President of RespectAbility USA, a nonprofit organization working to enable Americans with disabilities to achieve the American dream. We are very excited to have a wonderful speaker today to speak about this important topic. It's disability etiquette, tips for interacting with people who have disabilities. Our speaker is Julie Hensler-Cullen, registered nurse, Master of Social, MSN, and she's the Director of Education, Quality, and Advocacy at Moss Rehab. I had the pleasure of visiting them in person recently and seeing some remarkable work there, including the ReWalk, which enables people who are paralyzed to use an exoskeleton to walk. They do really wonderful breakthrough work. They're part of the Einstein Healthcare Network, and they repeatedly rank among the nation's top 10 rehabilitation hospitals, and it's the #1 in Pennsylvania, according to U.S. News & World Report. Moss Rehab provides specialized treatment for persons with traumatic brain injury, spinal cord injury, stroke, and other neurological disorders, amputation, and orthopedic conditions. Moss Rehab operates acute inpatient rehab programs at 6 locations and over 20 outpatient sites throughout Pennsylvania, New Jersey, and Delaware. This webinar has actually gone global, however. We literally have hundreds of people who have registered from all around the country and some from other countries. Our speaker, Hensler-Cullen, received her undergraduate nursing degree from Mercy College and a master's degree in nursing administration from LaSalle University. She has over 20 years of experience working at Moss Rehab advocating for persons with physical disabilities. She's a proud recipient of the 2012 Rehabilitation Leadership Award from the Pennsylvania Association of Rehabilitation Facilities. Before she begins, however, I'd like to just let you know about a couple future upcoming webinars. The first is that we're working with a broad coalition of wonderful disability organizations on a toolkit that is for people that are working on employment-first efforts in states, particularly in advance of the new WIA implementation, recognizing the changes with 503 and other things. And so we're working with great groups like the DD Councils, Best Buddies, Paralyzed Veterans of America, and other organizations like the Autism Society of America on creating a disability employment performance self-assessment tool. We will be launching that soon, and we'll send you an invitation to it. It will be myself and Donna Meltzer, who's the CEO of the National Association and Council on Developmental Disabilities, who will be introducing that tool. We also have coming up in January implementing WIOA and Better Bottom Line, employing people with disabilities, lessons from the front line, with Speaker Secretary Rita Landgraf, Cabinet Secretary from the Department of Health and Social Services from Delaware. I'm sure many of you are aware that the state of Delaware is led by Governor Jack Markell, and Markell, when he was chair of the National Governors Association, made disability employment the top initiative. So Delaware is far ahead of most of the other states, and the lessons that they have learned have really been very helpful, and Secretary Landgraf is the leader on the cabinet for Governor Markell on implementing all of those efforts. She's a terrific leader and speaker. And then additionally, on February 19th, we have a webinar coming up, Best Practices and Success in Inclusive Employment in the Hospitality Sector, with some amazing speakers as well. But I'm really delighted to present a speaker who I already got to hear when I was at Moss Rehab in person, and so I want to turn it over so that we can go through this fabulous agenda. Thank you again for doing this for us, and thank you to all who have joined us. Now to the official presentation.
Thank you, Jennifer, and hello, audience. I am especially proud to be with you today, as many of us celebrated the International Day of Persons with Disabilities yesterday, and coming on the heels of that, it's exciting to be able to share this important information with you and ask you to help me spread the word about just the importance of disability etiquette. As part of our agenda today, we will be discussing and acknowledging some best practices. I will be reviewing the person-first language and giving several examples of person-first language. We'll be reviewing some tips of communicating with and interacting with persons with different types of disabilities and the importance of promoting disability etiquette. We'll have plenty of opportunity for questions and answers, and if questions come up during the course of the presentation, please feel free to use the question prompter, and I will keep my eye on that as we proceed so I can answer your questions. And although I've done this presentation with many different groups of individuals, restaurant staff, I recently went to the U.S. Mint in Philadelphia, Pennsylvania. I've spoken to new staff in hospitals and old staff in hospitals, and as many times as I've done it, I learn and refine and revise the presentation based on feedback and information that I learn along the way. Most recently, some of the presentation you will hear today and see today are components of that are the result of working with a group here at Moss Rehab of persons with many different types of disabilities, family members, and staff. And so, I'm hoping that you'll learn with me and be able to, again, spread the word. So why a disability etiquette program? It sounds like those of you who have signed on obviously know the importance of it and want to learn more. But interesting, when people are in the workplace, in schools, in any community, using disability etiquette with people with disabilities, people will feel more comfortable. Not just people with disabilities, but people without disabilities will feel more comfortable and less awkward. Practicing disability etiquette is an easy way to help people with disabilities feel welcome. Again, I've recently shared this information in many different places, and recently at the restaurants in Center City, Philadelphia, they recognized that as the demographics are changing and more people in our country and in other countries have disabilities, they want to capture that market, and so are asking for presentations like this, because to them, good etiquette and skills in working with persons with disabilities means good customer service for them. So just a backdrop. Certainly, I'm preaching to the choir here, but we know that a great percentage of people in the United States have a disability. And as you can see on the slide, or read on the slide, that a breakdown is that as we are aging, as many of us are aging, the percentage of persons with disability in our age category is increasing as well. Many members of the advisory board of Moss Rehab use the term TAB or TAB, temporarily able-bodied, and they advocate and heed others to know that at some point in time, just with the normal aging process, many of us will live with a disability at some time in our life. So still setting the stage, people with disabilities report that they participate in many different activities, and this information was taken from a Harris survey in 2004 and Kelton research in 2008 and a Bobby Dodd Institute survey of September 2008. And it reflects the importance of recognizing why many individuals need to learn more about working with and communicating with people with disabilities. You'll read there that obviously people with disabilities are out and about, obviously, and you can read there they're working, They are going to a restaurant, they are at places of worship, and they are socializing at an increased ability. With many of our laws requiring our facilities to be more accessible, we're going to see hopefully more people not having barriers to accessibility. So one of the most important pieces of information I will share with you today is to relax. People with disabilities are people just like you, just like me. They are people with families, jobs, likes, dislikes, problems, and joys. And as I worked with the focus group of representatives of persons with different disabilities and their families, one of the key points they asked me to drive home in my presentations is that they don't want people to feel sorry for them. They don't want people to pity them or feel badly. They certainly appreciate a good dose of empathy, but sympathy and feeling pity is not what they're looking for. This quote on this slide: sometimes the worst thing about having a disability is that people meet it before they meet you. I first saw this quote back in 1990. I had just started working at Moss Rehab, and it was on the door of a colleague. I made a copy of it, and it has become very important to me. Many of us are self-conscious about the way we look. We wish we could be better at something, or we worry about things that are invisible to our friends and our families. And it sometimes can influence the way we act. Sometimes when a person has a disability, fitting in can be even harder. A disability can be the first thing that people see. Sometimes it's the only thing that people see. And so my presentation and what you'll learn is to help us kind of break down that barrier. Some people don't see the person. They only see the equipment. They only see the disability. We're going to talk a lot about words today. Words are powerful tools. Language, I believe, really does reflect society's beliefs. I believe it's very important to put person before the disability, and I am a strong advocate of person-first language. Why person-first language? A person with a disability, I believe, is a person first. A disability or a disease should not and does not define a person. So we'll talk a lot about some of the bubbles you'll see on this slide. I advocate for the use of "she has autism" as opposed to "she is autistic." I see the latter, "she is autistic," as labeling, where she has autism, she also could be a daughter or a student, so it's less limiting. Some best practices I'd like to share. Everyone responds to language differently. It's really important, and the title of our whole presentation is "It's Just Respect, Tips on Disability Etiquette." And so it's so important to recognize and focus on being respectful and polite, and as I said earlier, just to relax. Certainly, start out communicating by introducing yourself as you would with any other individual or in any other situation. Adapt your communication as necessary or as requested. If you unintentionally offend someone, just apologize, and always be gracious and respectful in communicating with all people. So let's get down to person-first language. And it's just that, putting the person first. I have a series of slides with examples of the use of person-first language. I'm asking you to please use person with a disability, person who has had or had a stroke, a person who has polio or had polio, a person who has multiple sclerosis. Previously, you may have heard or you may have said handicapped. And we all, many of us on the line may know the history of that, where the cap in hand, where people with disabilities were seen as outcasts and begging for money for a living. Previously, and oftentimes even in the news, you hear the disabled, the crippled. And so it really does categorize. When I hear these terms, because language is so powerful for me, it makes me cringe a little bit. And yet we do hear it so frequently. So again, part of my presentation today is to ask you to help me spread the word and get people's attention, asking them or telling them why we want to put the person first. Oftentimes we'll hear people who had had a stroke or have multiple sclerosis or polio as victims, that a person is a victim. Recently in the news, we've all heard about the outbreak of Ebola in Africa and in other countries. And it, again, cringes when I hear the Ebola patient. It just, rather than a person who happens to have contracted Ebola, it's recently affected me. And yet, with our population we're talking about, when we hear the words wheelchair bound or confined to a wheelchair, it really does limit the individual. I don't think any one of us, anyone, would want to be considered a victim or to be want to be considered bound. I would say 100% of the people I know who use wheelchairs are not bound to them. They transfer successfully to do many different activities. And that's the information we want to kind of get across. And by using that person-first language, we have more opportunities to do so. So when people think about people with disabilities, many people think about wheelchairs. So we're going to talk about that first. So the use of person-first language with wheelchair users or people who use wheelchairs. You want to put the person first. So the person who uses a wheelchair, or acceptable is wheelchair user. Again, I mentioned earlier, you may hear confined to a wheelchair or wheelchair bound. Person-first language with individuals who are blind or have low vision. I'm asking that you put the person first by saying the person who is blind or the person who has a visual impairment. And previously, you may have said that blind person. Again, person with a disability, where, repeated again, you may have seen written or quoted the disabled or suffers from a disability. And I'm repeating some of these because I do believe, just like we're all subject to many, many commercials as we watch TV or even on our iPhones these days, and people will repeat things over and over again to drive the message home. Well, you're going to see me doing the same. It's important for me to help drive these messages home. What about person-first language, person who is deaf? I advocate for saying the person who is deaf or the person who has a hearing impairment rather than saying the deaf and dumb, and suffers from a hearing loss. Person-first language with people with mental illness. Put the person first by saying person with a mental illness rather than some of the less common or kind words like crazy or psycho or lunatic. As I share this information with you, please know that I'm aware of some of the criticism of person-first language. in the community of persons with disability and in the world of working with people with disabilities. Yet I do believe that words are powerful and that they do raise awareness. And by raising awareness, I believe that they educate and that they can positively affect attitudes. As I mentioned before, we'll talk a lot about people who use wheelchairs and tips for working with people who use wheelchairs. Obviously, individuals who use wheelchairs have a variety of different types of disabilities. And along with that, certainly many different abilities. Some can use their arms, some can walk for short distances, and some, because of medical conditions, may need to use wheelchairs to conserve to conserve energy. So, how do we work respectfully with people who use wheelchairs? It's important to remember that that wheelchair is important to that person's independence, and that that wheelchair is a part of that individual's personal space. So if you think about that, it'll help guide some of these tips. So I'm asking you to remember and to tell people not to lean on wheelchairs. Don't hold on to a person's wheelchair. Again, it's really part of their personal space. It's important to talk directly to a person using a wheelchair, not to an attendant or a third party. And there's a lot of helpful Hannahs out there. I hope there's no Hannahs on the line. I don't mean to offend you, but there's a lot of helpful people out there who may want to say, oh, there's a person in a wheelchair. I'll see if I can help push them. And so we ask that you don't just take it upon yourself to push someone in a wheelchair, but to ask. Always ask. So as a person myself, I was an individual who was in a severe car accident back in 1994 and actually had an opportunity or had the experience of needing to use a wheelchair for a period of time. And I worked in the hospital. I was able to come back to work while still in the wheelchair, using the wheelchair. And I was in an elevator once, and I felt like everyone was talking and I was not involved in the conversation. So I learned firsthand how important it is that when a person is in a wheelchair, that others should try to come to eye level when communicating with them. Now that's not always possible, to sit down or to squat, especially with my situation in an elevator. And yet, I learned from other individuals who use wheelchairs more frequently, for some, having people tower over them and look down at them is a very unpleasant situation. And so I ask and advise that you do use common sense, and if and when possible, move to a location where you can talk eye to eye with certain individuals. Certainly you don't want to make the person strain to look up when you're communicating. And I'll move on from there. In working with persons with cognitive or developmental disabilities, certainly we ask that you never make assumptions about the person's abilities. It's important to be respectful and talk directly to that person. My background as a nurse was working with children and adolescents. And certainly you want to make sure that the adult, the caregiver, is involved in a child's care. And yet I got a lot further by talking to the child and to the adult. And there's a creative way, especially for us in service positions, to be able to do that. To always talk directly to the person with the disability. You involve an advocate or a caretaker when necessary. It's important when you're working with people with developmental disabilities to, assess that they understand the information that you're sharing, and as necessary, break the information down into easy-to-understand components. There's a danger here, and many people will begin to use baby talk or even a sing-song type of speech, or talking down to people with developmental or cognitive disabilities. And it's important to avoid doing that. While interacting with people who have visual impairments, it's important to identify yourself. Certainly, again, recognize that you don't want to startle someone, so you never should reach out and touch someone, especially in the back, unless they know you are there. And we learned from some of our artists who submit works for an art exhibit here at Moss Rehab. We have several artists who are blind or have low vision, and they shared with me that they have had experiences where they might be in the studio or at home, and they're carrying on their part of the conversation, and shortly realize when they don't get a response that the other person has left the room. So they personally asked me to remind individuals to somehow ensure that you tell the person when you leave. It's important that individuals with people with disabilities who have assistive devices that they may put down temporarily, be it a cane or some other device, that other persons do not move that device, so that the person with a disability can be confident that that piece of equipment is where they'll expect it to be when they need it again. There's a lot of information about service dogs and the importance of being respectful to the job of a service animal. I'll share that it's important that you always would ask before petting or calling out to a service animal. It could distract them. That same individual, the artist, said to me not to worry if people say things like "see you later" or use terms that deal with vision. They shared with me that they very frequently will say, "I'll see you later," and not to be concerned. What about communicating with people who have hearing impairments? And I did have a comment on my question screen that people who are deaf prefer to be called the deaf community. And again, I understand that and certainly respect that. And so when we're communicating with people who have hearing impairments, it's very important to gain eye contact with that person. Some people will read lips and some people won't. I have a Bell's palsy that some people don't recognize, and yet I have been told by people who do read lips that my lips are difficult to read because of that alteration in my lips. So it's important that you gain eye contact and communicate directly with the person. Use a normal tone, speak clearly, and then when possible and helpful, certainly use facial expressions or body language. It's another important point to remember and to educate others that if a sign language interpreter is present and is being utilized, to continue to speak directly to the person, not the interpreter. Here at Moss Rehab, as part of our research institute and our stroke specialty program, we have an aphasia center for individuals who have receptive and or expressive aphasia, which is a difficulty in expressing or receiving the spoken word. And oftentimes, some persons with aphasia or people who have difficult speaking. There are often times that a person who has cerebral palsy, if the muscles in the mouth and throat area have been affected, that individual may speak in words that may not be clear to the general population. And so it's really important that you never pretend that you understand what the person is saying and just say, sure, sure, sure. I've been asked by people who have that experience, it's better to just acknowledge that you do not understand and then look for alternative ways to communicate, whether that is writing something down on a pad of paper, but stick with it and try, and if you don't understand, be honest and tell the person that you do not understand. So what about some additional tips? Never assume someone's physical and or cognitive abilities based on their physical appearance. So for example, if a person, yes? So if a person has a prosthetic hand or limited grasping ability, if they offer to shake your hand, please then offer to shake hands with them. Again, it's just respect, and we're asking that you just use common sense. One of the additional tips I also like to share is to please advocate and encourage all people to be considerate of spaces and resources reserved for people with disabilities, whether that's restroom space, space in theaters that have a wider aisle area, and our favorite, certainly parking spaces. It's important that all of us understand signage, noting the accessibility of spaces and resources for persons with disabilities. I often hear concerns by persons who drive adaptive vehicles that, especially those that may have a lift that needs a wider parking spot, that cars will park next to that handicap parking spot or that accessible parking spot, not considering that the individual can't access their lift. So again, it is important that we advocate for the understanding of accessible signage. Disabilities present and affect all people differently. There are many types of disabilities. There are temporary and there are permanent disabilities. The first picture there is a gentleman who I know, and he has a spinal cord injury and is using ReWalk, the exoskeleton Jennifer mentioned earlier in this presentation. Never assume, again, that a person with a disability has a certain type of disability. And some disabilities are temporary and some are permanent, as I mentioned. So a person with a spinal cord injury or some other type of disability can have a broken arm or a broken leg, causing them to need additional assistive technology or adaptive devices. Many disabilities are invisible. Some are visible, like this gentleman with an amputation who's using a prosthetic leg. Again, disabilities are not mutually exclusive. And you see the examples there again. Someone with a spinal cord injury could also have a traumatic brain injury. Someone who uses a wheelchair may have a temporary disability. I'd like to share some information about providing accommodations and assistance. Don't assume that someone needs your assistance. If you think someone needs your help, always ask. Ask if they want or need your help, and then ask how you can help. This is probably the second most important point besides relax. So again, ask certainly if the person would like your help, and then ask how that you can help. Certainly with the Americans with Disabilities Act, we have made great strides in providing accommodations in many settings. And we all know it's so important to preserve every individual's independence. And that's why it's so important to ask for help. As I walk through the halls of Moss Rehab and I see and work with persons who may be experiencing life with a disability for the first time, and they're learning to use a wheelchair, it's so important that they're building their upper body strength. And so for me to just, offer or push their wheelchairs more of a hindrance than a help. Again, always ask first if people need help, and then wait for their response. If they accept your help, allow them to direct and give you instructions about how you can assist them. It's important to follow the person's instructions and ask questions when necessary. People who have lived with disabilities for a long time really are the best to know how to provide the best service to themselves. I mentioned in our agenda slide that I want to really ask you to help me promote disability etiquette. I'm asking that you will begin to practice some of these in your written words as well as in the way that you speak, using person-first language and practicing respectful etiquette. Lead by example. Remember, it's just respect. It's important that we promote disability etiquette with children. Again, leading by example and allowing and encouraging children to ask questions. Some of the members of the task force really did share stories of times where they have heard children asking questions of the adults they're with, and the adults have shushed them or told them, don't stare, don't ask questions, where the person with the disability, in most situations, would be more than happy to explain why they're using a certain type of equipment. Now, that's not 100%. Certainly there are individuals who prefer their privacy, but again, if we lead by example and help the children advocate these or navigate these situations, then it will be a better world. We have a disability etiquette program for children. The photo in this slide shows you where we have our Kids' Day at the Art Show, where we have children create art while simulating that they have some disability or impairment. The children in this slide are creating art using their non-dominant hand. Other types of activities we employ would be that we would create mouth sticks and allow children to see what it would be like to use a mouth stick, like a person who has a spinal cord injury who would use a mouth stick to paint, what that experience would be like. So any of you would be more than welcome to contact us about this program that we conduct for children. At this time, I'd like to open the program up for any questions. I'm going to look down on my scroll here because I think there are a few in the queue.
The first question is from Susan M., who asks, what do you do when someone is baby talking to you or assuming that you don't know how to do something? I have a mental impairment, and I got treated like that by adults throughout all elementary school and now at DHS, especially as I am filing. So what do you do?
That's a very good question. Thank you for posing it, Susan. My advice is that individual, or you, Susan, if it is you, would take the opportunity to communicate to your colleagues that when they speak to you in baby talk or talk down to you, that feels disrespectful, and that you would ask them if they would please talk to you the way they talk to all of the other colleagues and workers.
Thank you. There's a lot of questions about the PowerPoint. This is Jennifer Mizrahi. So let me just let you know that we are just so honored that Moss Rehab and that Julie has done this presentation for us. But we do not have the rights to these PowerPoint slides, and so we are not emailing them out. They will be provided on the YouTube channel of RespectAbility USA along with the full webinar so that you can watch it, or anyone else who wants to watch it can use it through that video library at any time via YouTube. If you're interested in having it in a different way or for some other purposes, then there is a contact information on the website here that if you email livingbeyonddisabilities@einstein.edu, you can get more information on how you might be able to obtain the PowerPoint. Operator, we're ready for any calls that want to come in for questions. And operator, if you can also let people know how they can email in their questions via this online service.
Will do. For those of you who have dialed in and would like to ask a verbal question, please press 7# now to queue up. I will release you one or submit your chat questions in the lower left corner.
So I have a question that just came my way here. It's Julie. So they say, what do you do if you have trouble understanding a person who is trying to communicate with you? And I believe the question is if you have trouble communicating with a person with a disability. And what I'd like to do is reiterate again the importance of being honest. If you don't understand what the person is saying, please ask them to repeat it. Please, you may ask them to repeat it more slowly so that you understand it. And again, I recommend that you ask for or suggest that using another means of communication, if there's paper and pen available, that you could, as a resort, have them write the question down.
The next question is from Lauren. How can families talk have discussions with physicians who are inappropriately attributing symptoms to the disability?
So I think there are wonderful, wonderful resources about how to talk to your doctor for any healthcare consumer. But very importantly, if there are questions about your disability, and again, many people with disabilities become more expert in information about the disability than some of my colleagues in healthcare. So I would certainly, I recommend looking for some of those resources online, and this is kind of your homework, Lauren and others, but doing some homework, and you can just search in the computer how to talk to your doctor, and basically that's how I found the information. And then it really does come down to you kind of working with the physician and giving them information and then asking them for information back. I think that's the best way to proceed.
Sherry is saying that she finds that sometimes asking people to repeat more than once, that they become very frustrated and agitated and shut down. What do you do in cases like this? This is Jennifer answering that sometimes it's good to ask them if they would not mind writing it down or typing it out. It is not uncommon for people who have speech challenges to write things down so that people can understand them clearly. Sometimes people pre-prepare their questions before they go to a doctor's office, for example, so that they have them all written down for the doctor so that they can be sure that there's no miscommunication, that whatever is their strongest way to communicate, that they try and plan what questions they'll be asking, what concerns they may have, what symptoms they might have, so that they can be very, very clear with their providers or with anybody else they're communicating with. We also see Teresa M. has written, I get asked a lot of questions. How did you lose your leg? Or they look, and I have often said that I lost my leg, not my mind, or take a picture, it will lasted long, is what she writes. Are there other questions, operator?
No questions on queue.
So for Teresa, Jennifer, I would advocate that, when some people will stare, and I think, unfortunately, that's, we live in a culture where people are curious, and if it's something they haven't seen before, they will stare. And so that's where it falls back for us to be respectful and, to say, please don't stare at me, or, if someone asks you how you lost your leg, and that's private and you don't want to say, you say, I'd really prefer not to share that information. Thank you for understanding. I think as we can be confident and assertive with our the way we present ourselves, that should help.
Yes, I'll give folks a chance to think if they have one final question, but this is Jennifer again. I want to reiterate that we do have some more conference calls that are coming up and webinars. One of them will be introducing this very exciting new tool that we have on employment for best practices for states to have, for governments to have, for policymakers in terms of enabling people with disability to achieve integrated competitive employment. So that's the dignity and opportunity that competitive integrated employment has and offers. And so there will be a toolkit that is going to be offered. Very excited that we're working with the DD Councils, with Paralyzed Veterans of America, with Best Buddies, and with other different national disability organizations on introducing that toolkit. Very excited about our webinar on best practices for employment of people with disabilities in the hospitality industry, and also for the upcoming webinar with Governor Markell's key point person for the state of Delaware, Rita Landgraf, who is the Cabinet Secretary responsible for Health and Human Services, but is really a national leader in the innovations of expanding employment opportunities for people with disabilities. And I will also say that the state of Delaware has made it a new practice to be a fully inclusive employer of people with disabilities themselves, and that has taken a lot of new thinking and a lot of training, and that she will be sharing some of her experiences and best practices. We are a nonprofit organization, and all of this is made available free of charge, and all of the past webinars can be found on our YouTube channel. Julie, I'm really so grateful for your presentation. I also want to just give a shout out to the Moss Rehab Center. Again, it's a proven leader in educating the community about disability etiquette through its programming for children and adults. And I also want to thank the Albert Einstein Society for their support of this program and for this PowerPoint. And I want to remind folks that the rights to this presentation belong to Moss Rehab and to Einstein, not to RespectAbility. And we're very grateful for the ability to put it up on the web for this webinar and to have it for free available through YouTube for folks who want to watch it later. But if they do want to get more information that the the contact info is right here on the web. Operator, are there any final questions?
No questions.
Oh, I see online it says, from Sherry, I have a consumer that is unable to use this ARMS and very hard to understand because of our customer, that is unable to use his arms and very hard to understand because of a stroke, which means he cannot communicate in writing. Is it appropriate to bring a colleague in to see if they are able to understand, or is this a bad choice? Julie, what would you answer to that?
Yeah, thank you, Jennifer, and thank you, Sherry, for posing that. So it sounds like if you're working with this consumer, advocating that it sounds like a speech therapy consult to help identify some additional means of communication might be in order. There are so many pieces of assistive technology that might be able to help in this situation, just types of communication boards that may be able to help this particular individual. Certainly with that colleague or that patient or that consumer's permission, and if there is a particular person in your office who really understands that a person and has a rapport with that person, then certainly with the person's permission, you could ask the colleague to assist. But I think it sounds more importantly that it would help this individual in other situations if you help and give them some tools, and perhaps doing so through a speech therapy consult might be appropriate.
I just want to say how much I agree with that advice, that I have a family member in that identical situation, difficulty writing and difficulty speaking, and so having a speech therapy or other kind of consult is very important. Sometimes people are trying to be polite and they go through telling a person with a disability, when they don't really understand, as Julie said earlier. This creates a lot of misunderstanding, and you're doing the consumer a favor by helping them figure out a system that will enable them to broadly communicate in other such situations. And so you shouldn't feel badly about the fact that you can't understand. You should see it as an opportunity to empower that individual to find other more effective communication techniques, which do exist. And in a more significant situation, sometimes people just use assisted technology by directing the gaze of their eyes to help communicate, if that's the only way in which they can communicate. But it's far better to use your eyes to communicate than to not be able to communicate at all. So the clear communication is very, very important. Julie, you've done a wonderful job in leading us through this disability etiquette webinar. We've had a large number of people join us. We're really here as a public service to you all and to the field. Please feel free to tell your colleagues and your friends about us and our webinar series, and to feel free to share the link after this is over. So thanks to all who joined. I want to thank Julie again. I want to thank Moss Rehab for your extraordinary work, and we look forward to having you all join us at future webinars in the future. Thank you.
Thank you, Jennifer.
This concludes.
The moderator has ended